2/3 of citizens polled in the 19 African countries have indicated a willingness to receive COVID-19 vaccines. This is according to a report released by the Partnership for Evidence-Based Response to COVID-19. For more on this, I'm joined by Dr. Emmanuel Agogo, the Nigeria country representative for the organization Resolve to Save Lives. Good to have you with us this afternoon, Dr. Agogo. Now, it has been a year of lockdown, at least in South Africa. When you do your research across the continent, what has been the impact of COVID-19 on people's lives, on their livelihoods?
So, like we know, in terms of the data coming from Africa CDC, in terms of numbers, we have had recorded from the testing well over 4 million cases, with mortalities that have crossed 100,000. We've reported over about 111,000 deaths across Africa. And you know, obviously, in terms of testing, you know, just under 40 million people have been tested. This survey that was conducted by the Partnership for Evidence-Based Response to COVID-19 looked at various thematic areas, including including the effectiveness of the PHSMs, the public health social measures, you know, the lockdowns that were implemented, and as well as, you know, surveying trust across African countries, the 19 African countries where this survey was done, and also trying to understand the impact. So across most of the African countries, there is evidence that people have lost incomes, people have lost jobs, and the economic impact has been significant. To be precise, in all the studies also looked at empirical evidence of people staying at home and so on and so forth. So we have that data for all the 19 African countries that were done. Some of the things that we saw that happened was that people were not going into healthcare facilities. You know, people were skipping access to healthcare, as well as the fact also, like I said, that food insecurity became an issue because people there was significant loss of income in many of in many respondents. Up to a third, even in South Africa, reported reduced loss of income. And so that's quite significant across the continent.
And one of the key aspects that you focused on here is the willingness of individuals to actually receive a vaccine. When we look at Morocco seems to have come up tops with 91% of those that were surveyed there saying that they were willing to take the vaccine. But take us through the spectrum as well and how different countries reacted.
So there's a wide range in terms of countries, how countries responded to the survey. And it's quite significant to see that many, up to 90% in like you said, in Morocco, said they were willing to take, and less than just about 30% in Cameroon and Tunisia said that they were unwilling to take the vaccine. Although the continental average was about 60%, and that was about similar for Nigeria, where I am, as well as South Africa. We found as well that, just by cursory looking at the data, that there were quite a few reasons why people felt that they would not take the vaccine. These included concerns around, not trusting the vaccine, that it will work for them. There was also generally low risk, personal risk perception, as well as, the effect of the misinformation and disinformation that has gone out about COVID-19 generally. We've also seen from the data in terms of the vaccine, in terms of whether people are going to take vaccine, that there's some slight differences where people who had underlying conditions, people in rural areas, men, people, interestingly, of lower income, there was some slight difference where all these groups that I've mentioned were more likely to say will access the vaccines when they are available.
You mentioned men there. As far as the gender split is concerned, did you find that more men as opposed to women were more open to receiving the vaccine or not?
Yes, so the data did show that men were slightly more willing to take, more willing to access the vaccines when they're available. I mean, the specific data, it showed that for men, that about 64% of men versus 67% of men versus 64% of women. And also, like I said, about 70% of those who were least educated compared with 64% of the most educated. So there are some issues there around, trust. Like I said, in countries where people were quite satisfied with the government response, up to 70% were saying that they were willing to access the vaccines, while in countries where government trust was a lot less, about 50%. Another key thing that came across very strongly was where the Ministry of Health and healthcare workers are trusted, people were more likely to say that they will take the vaccine.
All right. Well, thank you so much for that update, Dr. Emmanuel Agogo, there for the Nigeria country representative for the organization Resolve to Save Lives. A very interesting survey there, interesting results as well, with Morocco coming up to 91% of that population willing to take the vaccine. And you're probably wondering what the numbers are looking like for South Africa. South Africa fared at 61%, Zimbabwe at 61, Nigeria at 72, Egypt at 78, Mozambique at 75. But the general average for the continent, at least the 19 countries, is around the 60s. So looking like the majority of those on the continent say yes, they indeed do give a nod to the vaccination process.